We can begin.
Hey, Michelle.
Hi, how are you?
Good. Fancy seeing you here.
Yeah, saw the invitation. Thought it'd be a really interesting thing to watch. Yeah.
How did you see the invitation?
I got a link to an email.
Oh, okay. That's reasonable.
I have no idea how I got it originally, but Global Equity, GlobeMed.
Yeah. Globe Med. Yeah. That's the group.
Yeah.
Cool. And Priya, what up?
Hi, John. How are you?
I'm good. How are you doing?
Doing well. I'm
You
excited.
in Texas or Chicago or elsewhere?
I'm in Texas. I'm in Austin.
Sweet.
Yeah, I love the plant behind you. It looks so beautiful.
Oh yeah.
A
We're
well-curated space.
No, well, it's not. It's empty. I'm moving. It's all an illusion. You know, we live in just like a hall of mirrors and total fictitious, Instagram constructions. I am currently moving, so I'm moving on Monday down to Baltimore. So all of our books and boxes and everything else are in the other room. So
Okay.
it's a complete disaster. So this is the best I could do. But actually, yeah, the plant is nice.
It is. Well, congrats on defending your dissertation.
Thank you. Yeah, I was just telling these guys is sort of a slog and a never-ending sort of series of bureaucratic hurdles to get the thing sort of like officially done. And I just got the notification this morning that it's officially done. So that feels good.
So happy to hear that.
Yeah, it definitely feels good. So what's the order of events? How do we proceed here?
Cool. I'll go ahead and do the short little welcome, and then I will hand it over to you. So thank you everyone for joining us today. Today is our July installment of the Health Equity Speaker Series. Today with us we have John Schaefer from Right to Health Action, and he will be with us today. But before we get started, I want to begin by reminding you all that if you have any questions, feel free to put them in the chat, DM myself or India, or wait to the end when we'll have a short time for Q&A sessions. And now we will hand it over to John to begin his presentation.
Sweet. Yeah. Thanks so much, Jonathan. And, India, Jonathan, Priya, you all know each other, but Michelle is from the R2H Action team. I don't know, Michelle, do you want to just briefly say hi and introduce yourself?
Sure. Hi, I'm Michelle Gross. I live in Portland, Oregon, and I'm primarily involved with the fundraising side of Right to Health Action. So I'm really excited about hearing John's presentation and more about the global health equity aspects of our work, because that's the piece that I have least involvement with right now. So I'm really excited about being with you all today. Thank you.
Cool. Yeah, thank you for being here. So yeah, I guess I have like slides and stuff. Is that useful? Or should we just sort of freewheel it?
I mean, we can do any version. We do post these so that members of the community can watch them after. So maybe it would be worthwhile to
Not too freewheeling, I got to keep it a little buttoned up. It will be recorded. Yeah, no, I'm just kidding. Yeah, okay, I will share my screen then. If I can, can you give me like the ability to do so? I don't know if I.
Yes, you should be able to do so now.
Oh, okay. Let's see. Oh, Keynote. Let's see. Oh, maybe I have. Share. Allow Zoom. Oh, I have to open system preferences. Interesting. Sorry, I got a new computer, and now I have to give Zoom the ability to see. Allow apps. Yes. How do I allow that to happen? Oh, I have to click here. Use password. Okay. There we go. Oh, I have to quit and restart. Oh my God. I'm sorry, guys. This is a disaster. Can I do that real quick? I'll be right back. Okay, sorry. Thank you. All right, I'm back. Can you see me? Hear me?
Yes.
Okay, sweet. Sorry for this. Uh, mm, mm, Keynote. Share. Now you see my screen. Beautiful. Now, how do I make it full screen play? Okay, great. So yeah, what I am hoping to do is present sort of my take on, a bit of my own sort of evolution on thinking about health equity work, what it means to be talking about health equity work from a position of relative privilege and, a standpoint of resources and my own position as a white guy. What does it mean to be, in solidarity with people sort of on the receiving end of, just enormous and historical violence and oppression and extraction. And, how are pandemics sort of bound up in those kinds of social forces that haven't directly affected me in profound ways, small ways, as they've affected all of us in big and small ways. But what does it mean for me as a person and perhaps for us as a network of people concerned with these kinds of things? And this has been something that's been certainly a motivating and animating sort of concern and quandary and paradox, for me in my life, as I imagine has been for yours. Wrestling with, okay, well, what do we do? These things are out there. We know them. We're bombarded with the violence, the challenge, the oppression every day, whether it's through social media or through our own personal lived experience. And it's like very easily overwhelming and I think exhausting and easy to tune out and turn off or distract ourselves, right, from these kinds of realities, or just sort of obsess over them and sort of get into sort of spirals of just consumption of social media and content in ways that, it's hard to see how pragmatically that moves forward anything that can be useful. And so, again, I don't have any clear-cut answers. These are the kinds of concerns that I, am concerned with and have tried, in my own small way to wrestle with. And we have as well through Right to Health Action, and obviously GlobeMed has as well. And just to back up a little bit and say a little bit about myself, I worked with GlobeMed for a long time during college. This is way back in sort of ancient times, sort of 2005 through 2009. I was in college at Northwestern University when GlobeMed was really just a concept. It was just getting going. It hadn't yet formed a national network, hadn't formed a national or global office. There were no paid full-time staff, just a collection of students sort of wrestling with banging our heads against the wall of these kinds of concerns that I was talking about earlier. And what was really sort of transformative for me personally, and I think this group of people who are all concerned with these sets of similar issues, was that, the best we can do, in fact, the only thing we can do is link arms, and work together in new ways, figure out how to build friendships and relationships with people in very different circumstances than ours, and devise new solutions, figure out how to shuttle resources to those solutions and fight for things that we believe in. So anyway, that was just the animating idea. It's not that complicated behind GlobeMed. And it was amazing. And the most inspiring thing I've ever encountered was to see that concept really blossom and expand beyond, I think, any of our wildest dreams. And it's very hopeful, but it's also daunting, right? Because it comes, head on into the realities that we are facing right now, and the challenges that we face right now. So anyway, all this is going to be a little bit of just rumination on these kinds of things, and, and some concrete things that we're doing right now that I think people can be a part of. So hope that's okay. And that's abuse. So it's been a rough year. We all know that. This is sort of a gift that, that we recognize and see, when we're sort of, you have to go about your daily life, even amidst, deep calamity, but it's still a challenge. This is a moment that, again, I'm reviewing stuff that we're familiar with, but we know that, most people in the United States and frankly, the world are subject to labor conditions, work conditions that are deeply unsafe, structurally violent, and put workers in danger, let alone while also exploiting them for their labor. We know that our healthcare facilities are stretched to the brim. I was just seeing today with the BA.5 variant of COVID-19 that because of sort of basically the ending of any kind of restrictions or mask mandates, Australia is having some of the highest rates of overcrowding of their hospitals and ICUs that they've seen throughout the entire pandemic. And so this is not done despite, what the Biden administration and others in the White House, are saying that, we can go back about our business and that COVID-19 is through. It very much isn't. And waves of increasing variants of, more severe and perhaps more transmissible variants are likely to be coming. And so we see in the United States sort of a sort of smashing together of structurally violent social phenomena, things like COVID-19, but also the way structural racism and police violence, combine, right? We see that the biggest drivers of COVID-19 in many communities of color are jails and prisons, right? They become epidemiological pumps, literally pumping virus into the most impoverished, structurally impoverished communities in the United States. So, this is the sort of, a take again on a reality that we all see and acknowledge. What's more, the institutions that are here to, supposedly protect us, pharmaceutical companies, the government, and others drop the ball and or are in fact in positions of extraction themselves, and we see extreme greed on behalf of many of the drug companies that have produced vaccines and therapies for COVID-19, including Moderna, Pfizer, and others. We've seen, well, this is a picture of Trump, but even the current White House, and we see it sort of manifesting again with the current monkeypox epidemic. I don't know how much you've all been following that, but that the White House has moved slowly and without as much leadership as we need to get the kind of funding and programs to deal with COVID-19 as we should. And then lastly, obviously, we see anti-science movements and sort of a far right sort of social movement led by Trump and his colleagues that would seek to undermine sort of the basis of a just sort of science that can help us understand and make good arguments about what should be done. So, again, this is sort of the bleak side of the picture, but there's a more hopeful one that I hope to present as well. And so, all this, kind of, well, what do we mean by a right to health? And this is actually a picture of a colleague's organization, a group called Article 25. Ankur Asthana, who's also a big part of the early days of GloMed, helped to launch this organization a handful of years back. But, and this is just sort of, when we're talking about the right to health, this is the most potent sort of rhetorical, and intellectual force that we can have to combat the things I just mentioned previously. And this is sort of, from my perspective, what Right to Health Action is trying to catalyze and organize around. And so, what we've been able to do really since the first day of lockdown in Massachusetts, I think Priya might have been on one of these early phone calls. I think you were. But we, got people together on, what did we have? It wasn't that many years ago that we used to do the most awkward thing in the universe. We used to have these like 100-person conference calls on like freeconferencecall.com. I don't know how many of you have used that, but it was just like, just madness and cacophony. And now we have Zoom, which like I think we can all agree sucks a lot. Like we hate Zoom calls, even though we're on a Zoom call. Like we're all over Zoom. We'd rather be in person, like, of course. But in those early days, we had no other choice. It was like pure lockdown. We had to be isolated. And so Zoom is what we had. And we started to have a series of these meetings, bringing together activists and organizers and people from different health justice groups. Oops, sorry, I'm just seeing the chat. I just want to make sure. Oh, I'm not trying to advance slides. Can you not see the slides?
Just the main slide.
Oh, it's not moving?
Yeah, that's what I was trying to tell you. If you were moving through slides, we're not seeing anything but the first one. And now we see
really?
Right to Health Action, the story of us.
Oh, okay. Now it's working. Okay, good. Cool. Yeah. So anyway, we started hosting these Zoom meetings and we were like, well, what are we going to do? And, it started to develop into a set of a pragmatic set of programs and policies that we could fight for. And also amidst all of this, I've talked with lots of students, who are like you all sort of thinking about, well, what are we going to do to change all of this? And basically what I want to do in the next little bit, I obviously want to talk about Right to Health Action, but I also want to talk about health social movements and sort of share a bit about sort of how sociologists and others, talk about health social movements. So, what do you do to build one? What do they look like? And then talk about Right to Health Action as like an attempt to, along with many others, to build one itself. So what are social movements? So Marshall Gans, who's a professor at the Harvard Kennedy School of Government, but more importantly than that, was an organizer with the farm workers in Southern California in the 1950s, 1960s, and 1970s. He, along with Cesar Chavez and others who are working with migrant farm workers, mostly from Mexico, Central and South America, in California, working in strawberry fields and other forms of very difficult farm labor. We're working with these people who had very few labor protections, people who were being paid pennies per bushel, no social protections whatsoever, lived in extreme poverty and at the whims of sort of the landlords and the farm owners that employed them. They worked to organize this community, and they formed a union called the United Farm Workers. And the United Farm Workers were, a very powerful union that won massive gains and protections in the state of California and from the U.S. government to provide basic protections for farm workers there. I mean, a lot of these things have been eroded, and there's been a lot of change since then. But it was a really powerful example of what sort of a workers' movement could do in the face of extreme, structural violence. Anyway, Marshall has developed a real pedagogy and way of approaching and thinking about community organizing that I think is very important for us to think about when we think about health justice movements and health equity movements. And Marshall writes, social movements emerge as the results of purposeful actors, both individuals and organizations, who assert new public values, form new relationships rooted in those values, and mobilize the political, economic, and cultural power to translate those values into action. initiated in the hopeful response to conditions that adherents deem intolerable. Social movement participants make moral claims based on their renewed personal identities, collective identities, and public action. So I know we only have a small group here, but I'm curious which parts of this sort of resonate with you or are intriguing. If anyone could unmute and just share. I can call on people. And Jonathan, since you're in my line of sight, you got it. Anything that stands out to you about this sort of way of thinking about social movements?
Yeah, I just think we think about other things that way. So I think it just makes sense that we put a methodology to the social justice movement as well. And I think it helps just align movements, right? Like if you can put a model to it, it just helps people move that model forward and move that cause forward. So I think that just helps people think through the process better and clearer whenever there's a model, because that's what they're so used to seeing other things. So yeah, I just think that's a great way of putting it that I don't think many people see it as or have seen that in the past. So yeah, very cool stuff.
Yeah, interesting. Anyone else?
Yeah, I love the idea of movements emerging out of hopefulness. I think the idea of like there being a driving purpose and then the action for change feels like very expected. But I think the piece about kind of hoping for something better, imagining something better, there being a belief that people can change, that the ways we work and live together can be more equitable. Yeah. I think that is really resonating for me.
Cool. Yeah, I like both these points. I think the only other thing I might underscore for me, at least, is this idea that social movements emerge out of really purposeful effort, that they're not spontaneous. They're not accidents. I think sometimes we look back in history, we read about the civil rights movement and you say, well, like it almost feels inevitable. Like the good guys always win. And I think that that's not true. And they're driven by people who made choices, like real, like flesh and blood human beings who like chose to act in particular ways and challenged other people to step up in their own ways. And I think that is like where I get some hope. It's like, oh, like, we could choose to work differently, right? We could choose to do different things. And then it's a question of what, like, how do you do that? But we can learn from this, right? And we can, as Jonathan was saying, you can build a model that we can learn to deploy, right? You don't have to be in this place of complete uncertainty or a black box forever. We can actually develop good ideas about ways of working together that can be useful. So, again, I'm not going to go into great depth here, but key to organizing and organizing being the basis of the purposeful emergence of social movements is leadership. That you need people who assume and take on the responsibility of enabling other people in similar circumstances to step up and take leadership themselves. Leadership can't just be about one supreme, godlike figure who, has all the answers that we all look up to and get the answers from. That's not the kind of leadership that ever enables social movements to be successful. Even if we think about sort of the iconic people from history, people like Martin Luther King Jr. or others. Yes, they were leaders, but they were leaders in an organizing sense. They were building teams. They were coaching their deputies to build teams themselves. They were working with enormous organizations that dealt with the very practical constraints and challenges of everyday people and challenged those everyday people to step up into action. And I think, again, when we think about our own role, we think about this current moment, it brings into stark relief. Well, what kind of leadership am I bringing into this work? How am I enabling my chapter to proceed in new ways? How am I supporting the emergence of new kinds of tactics that can solve the problems that my people face? That's the kind of leadership that we need to imagine. And for us and for organizers, there's a lot of talk of the way in which leadership and organization building has to take sort of a decentralized, almost snowflake-like method in which you as a leader enable a team of people close to you who then enable teams. You have this sort of cascading approach in which an organization can grow. And again, this maps so strongly onto everything that GlobeMed is about, right? In terms of building chapters with sort of sustainable leadership within. And, social movements have to grow. And not everyone is on day one ready to be like, yes, sign me up. I'm ready to enable others to achieve shared purpose in the face of uncertainty. They're not going to necessarily. So you have to have a way of cultivating, developing, training, coaching, teaching people to step into those kinds of roles so that they have the resources, capacities, tools that they need to be able to take that kind of leadership role on successfully. And so for us, as organizers and for Right to Health Action and others, we really try hard to, identify a massive pool of people concerned with the issues that we're facing. I mean, it just so happens that Right to Health Action is trying to target the sort of structural roots of pandemics, and pandemics, almost by definition, affect all of us. So the pool of potential supporters for the kind of work that we're fighting for is literally everyone. We can't be in touch with everybody, unfortunately, but we can be in touch with a lot of people. And I'll talk more about how we've been able to build an enormous database of nearly 150,000 people who have said, yes, I'm interested in working with you to fight pandemics. But then you have to turn those 150,000 people who have said, yes, I want to be involved, I want to learn more, into, well, who's really interested in attending an event? And we have all sorts of events in which people can come and say, oh, I want to learn more. And that's an indicator maybe that they're a prospect, that they might want to step up. And then we have all sorts of volunteer opportunities, ways in which people can take on small bits of work, whether it be, attending a rally, coming to a meeting with a member of Congress, working to go to a campaign event for a candidate that's running for office and raising their hand and asking that candidate a direct question about something that they would like them to step up on leadership for. These are all different tactics and ways that volunteers can step up to lead. And then once you've seen people take that kind of leadership, show that they're willing to volunteer their time and effort, those people might be the folks able to step into leadership. And again, I know that this sort of maps so squarely onto everything that you're doing with GlobeMed, right? Because, it's not like chapter presidents are just immediately like step into that role. They demonstrate their capacity to contribute to the chapter's work over a long period of time, usually before they take on that role. So anyway, I'm preaching to the choir, but this is, how you might think about, organizing and how social movements grow. There's another sort of approach to social movement sort of theory. And again, I don't want to go like too deep into extremely boring like sociological stuff, but you might think of social movement sort of being an interaction between, a set of broad socioeconomic processes, things like a potential economic collapse and recession that we're sort of staring down the tunnel of right now. But those things we can't control. I mean, we're not powerful enough, and it would be unclear if we even could if we were powerful enough. But those things that are sort of in the atmosphere, in the social world that we inhabit, they do drive and relate to two things that we then can engage with. One is a set of expanding or constraining political opportunities. Right. So right now we have a Democratic White House, Congress, House and Senate, although questionably Democratic. We have a powerful slate of targets and opportunities, people who are, if at least in their way, the way they talk, receptive to different forms of progressive healthcare policy, foreign aid, global health engagement, pandemic prevention, et cetera, right? From the White House all the way down to the Senate and the House. So there, and that wasn't true, obviously with the Trump administration, where, we were facing a much deeper sort of existential political threat than we face currently. So broad socioeconomic processes can't control them, but they do create the context for different windows of political opportunity that we can choose to seize or not seize. There's also existing organizational strength, and this is called the guy who wrote this, Doug McAdam, calls this indigenous organizational strength. But what's meant here is just like local community organizations. And he was writing about the civil rights movement at the time and talked a lot about the African American church in the South and the way that church networks were such a powerful existing solidarity-based organizational capacity that could be the basis of the civil rights movement, and that created the context that was so important. But those two factors alone are insufficient to drive social movements. It requires new stories, an ability to imagine a structurally different future. And this is where the notion of cognitive liberation, that we can sort of get up and out of our current problems, the things that we're sort of facing right now, and imagine sort of a hopeful future, something that's structurally different than the one we're facing, and actually have some plausible pathway to get from where we are right now, which may be miserable, to some very different kind of situation. And well, what might we do as a group of organized individuals to alter this current situation? It might be modest, it might be stepwise, it might be incremental, but there are things that we can do. And so anyway, this is just sort of a way to think about, well, where are there expanding political opportunities? Where do we have existing organizational strength? And what kind of tactics and stories might we imagine using those combined things to drive a social movement? And, when we're thinking about this moment, we can use this model to maybe inform us. So health social movements are something specific. Also, by the way, what time should I wrap? Should I wrap at 1, or can we go to like 4 or 5?
Yeah, this is an all-day event, as long as you want.
I'm just kidding. Yeah, I'll finish 5. I'll finish in the next like 10 or so minutes. So health social movements are something specific, right? I mean, that we're facing health crises. We can't take on everything all at once, so an understanding of health social movements, I think, is quite useful. And so Phil Brown is a researcher at Northeastern. He's written a lot about really interesting work around environmental health and environmental justice, and the way people fight back against, terrible pollutants being injected into their neighborhoods and environments. Really interesting person, somebody who, I think, whose work could inform GlobeMen's work. So he sort of typologizes, thinks about categories or types of social movements that, do different things and have different focuses. One type that he has articulated is sort of access to provision of healthcare services. So, in many ways, GlobeMed is sort of this, right? Like working with local organizations to expand the quality of and work of healthcare delivery services. A second type of health social movement he calls sort of disease or illness experience or specific disability kinds of illnesses. These are often illnesses or diseases that have yet to be recognized or are faultily recognized by experts. And you could think about the AIDS treatment movement being a very powerful one, right? A novel infectious viral disease, seemingly concentrated amongst the gay community, and unclear sort of like what the epidemiology was, what the right interventions would be, and of course a wave of racism and homophobia layered on top of it. And so the social movement responds, organized by the people directly affected by that particular health problem, to challenge the dominant, professional ideas about that particular disease and to try to create change around it. And then a third and very important, I think, category of health social movements that Brown talks about are a little bit more abstract, but basically looking at inequalities in health outcomes across different groups. of people, different demographic groups, different categories of people. We all categorize ourselves and one another in all sorts of different ways. And you can identify, and we see every day, right, the magnitude of health inequality between white Americans and Black Americans in terms of maternal and child health, or case fatality rates from Ebola between people in Sierra Leone and Americans serving in Sierra Leone, or COVID-19 rates and rates of severe illness geographically across the United States. Any one of these kinds of inequalities can be the motivation for a kind of health social movement. So these are three categories that Brown advances. I'm going to add, sort of another, which is the notion of professional social movements, and these have actually been shown to be sort of successful as well. They're often this is a concept sort of coined by my advisor at BU, a guy named Joe Harris, who another person folks can engage with. His book is really good. It's called Achieving Access. It's a sort of comparative study of how universal health coverage programs advanced and sort of proceeded in successful or less successful ways between Thailand, Brazil, and South Africa in the wake of the AIDS treatment movement. But all three have universal health coverage in one form or another, but have significant inequalities between them. So, but he, through that work, talks about how, usually when we think of movements, we think of sort of lay people or regular folks sort of rising up in the streets. But he shows in his book that in Thailand, for instance, their universal health coverage program was really driven by a relatively elite group of fairly radical Marxist doctors who were able to organize with HIV patients, people living in rural parts of the country, to sort of slip in almost demands for a highly redistributive universal health coverage program as the country was going through a major set of democratic changes. And that enabled basically a particular party to run on that platform, and it became overwhelmingly popular, and now it's something that they can't do away with. They have, I think it's called 30 Baht to Cure All Diseases is the program, and and it's basically a very low fee that gets every Thai citizen access to care. And so anyway, professional social movements can be another way that we can think about this work. I had more detail on all this, but I think I might sort of breeze past this. I'm happy to share these slides. This was an example of sort of what we had fought, so just
John, you went on mute.
And you think this is the first time I've ever done this? Sorry, guys. So just wanted to say that, one example of a health access movement that I had the privilege to participate directly in was the struggle for the Affordable Care Act, right? I don't know, again, like not that long ago, but in the sort of a time span of college students might be sort of within or outside of the field of vision. But, in 2017, there was the most effective and concerted effort by the Republican Party, which at that point, remember, controlled House, Senate, presidency, to basically repeal the most basic social health protections that we have as Americans, the Affordable Care Act, right? So in 2017, the House, Senate had been working furiously to develop plans to repeal the Affordable Care Act. And obviously Trump this was one of his major goals early in his presidency, was to defeat Obamacare by whatever means necessary. And an enormous social movement, fought back against it. I mean, punchline is, the punchline, John McCain, not to make him the hero or anything, but he, along with a couple of other Republican senators, at the very last minute, voted against Mitch McConnell seen here looking sad, against the repeal effort. But it wasn't these people who did this. It was an enormous, and I'm not going to go through all this history, an enormous social movement and wave of activism that put tremendous pressure on these people to prevent the repeal. And we had all sorts of organizing meetings. We did all sorts of, fun protests. This is in front of the Massachusetts State House, a protest that we organized these like wonderful town hall meetings. This is in, nice liberal Massachusetts, but like we were able to get big turnout for these things. And I don't know if, this video, I'm not, well, let's see if I can share this video. Can you hear this?
We're not able to hear it.
You're not? I don't think it's playing. Be fun if this played. Well, do you see that? I guess it won't work.
Yeah, we see we saw like the video thing, but it didn't
Yeah,
start.
it didn't play. I know it didn't play. Sorry. Yeah, my technology is working poorly. Now I have to find my slides. Where are my slides now? Okay. Well, so much for that bright idea. I had a very dramatic and wonderful video of a bunch of us getting peacefully and non-violently arrested in the Senate buildings. There are, hundreds and hundreds of activists who, not stormed. This is like a loaded word after January 6th, but worked to basically show by being in the Senate offices and sitting on the floor, essentially, demanding that the House and the Senate not repeal the Affordable Care Act, and it worked. We were able to prevent the repeal of the ACA twice, which was pretty amazing. And here's some fun pictures of us in these offices, and this is just me saying, like, this kind of activism can be very effective. Skip through this. Obviously constituency-based health movements. I think, the Black Panthers and civil rights movement are some of the best examples of sort of how people, can work together to protect themselves. And a fantastic book on this you all might be interested in is Alondra Nelson, who now works at the White House, ironically enough. She wrote a great book called Body and Soul, which is a book about the Black Panther Party and the health programs. I mean, most people probably don't know that the Black Panther Party was one of the largest providers of healthcare to Black Americans in LA and major metropolitan cities in California and Michigan and other centers of the Black Panther Party. And so they offered all sorts of women's health programs, primary care, et cetera. And it was part of their political program as well. So embodied health movements is just a video, which I won't share as well, about the movie How to Survive a Plague, which I hope everyone's seen it. If you haven't, that would be a great GlobeMed event to do a screening of How to Survive a Plague and have everyone watch it, because it's very inspiring. But it's like, what do people do in the face of a pandemic? They rise up and fight back. And it's a powerful story of how ACT UP was able to mobilize a movement in the face of the AIDS crisis in the 70s, 80s, and 90s. professional movements, I mentioned Joe Harris's book, Achieving Access, but the work of Partners in Health, which I spent a long time working at PIH, and Partners in Health, I think, is an example of the kind of professional social movement people, again, from relative or significant privilege, working to leverage those resources in new ways and building new treatment programs and clinical programs in settings of scarcity. So yeah, the last thing I want to say is sort of like thinking about sort of anti-pandemic movements, which has been our work. And I know I have just a couple minutes left. And, Right to Health Action, I already talked a little bit about this, came out of, real desperation and like terrible fear. I mean, to be completely honest, just like not knowing what to do and being terrified for what this pandemic was going to bring us. And also being terrified of what was certain to be an impotent and violent response from the Trump administration. And it's grown into really an amazing network of allied organizations working together to imagine a pandemic-free future. We've been able to really mobilize and organize well over 100,000 activists. I think there are closer to 175,000 people in our email database currently, and which is amazing. But we have the real basis of our power is our core team, where we have about 40 people who show up every Monday to a Zoom meeting. We're still on Zoom to talk through, well, what is our tactics and what are our strategies going forward, and that's been really amazing. Here's some fun pictures of us in action. Again, a mix of sort of in-person, on Zoom, educational, activists, direct action, lobbying meetings. This is the sort of drumbeat kind of base level political engagement that I think is absolutely necessary, especially right now. We do have, until the midterms, we do still have the presidency, the Senate, and the House under the Democrats' control. And again, I'm not saying this from a partisan standpoint, I'm just saying it as an objective standpoint that the Democratic Party has more aligned with interests in health equity than the Republican Party does. I think that's like uncontroversial. And so, our job is to force, by whatever nonviolent political means necessary, force the Democratic Party and the people in power to take on health equity policies and measures. And like, that's our job. And we're going to do everything that we can to make that possible. And, pandemics are not an inevitable feature of our modern life. I think we're coming to a place that, and almost a consensus amongst elite politicians, that this is just the way of the future. Like, there's not much we can do about an uncontrolled monkeypox epidemic. There's just not much we can do against never-ending waves of COVID-19 variants that evade our vaccines. And we know that this isn't true. We know that with systems of care in impoverished, formerly colonized communities, with labor protections that enable people to do their jobs safely, with good public health and non-pharmaceutical public health measures like masking and social distancing, that there is no need for widespread disability and death from things like COVID-19. And again, these are the kinds of sort of nihilistic low standards that we're trying to fight against. So we believe that COVID-19 absolutely was preventable. It didn't need to happen the way that it did. These are all shirts, by the way. So if anyone wants a Right to Health Action t-shirt, you can go to r2haction.org/store. Maybe, I don't know. You can find it on our website. You can get a sweet t-shirt and mugs and other things. But we also believe, obviously, that the COVID-19 is not going away until we're able to vaccinate the world and we have the delivery mechanisms to do so, and that we can actually prevent the next pandemic. So these are the things that we're sort of really fighting for, and we're doing it very concretely through a set of real legislatable policies that we could, and the Democratic Party, frankly, could enact into law and put funding into, like, right now. These are things that we can win. we know we can win. We've already made great progress on almost all of them, but we're not there yet. So, I mean, just to go quickly through these ideas, first, a public health jobs score is no surprise, I think, amongst this group that U.S. public health has been eviscerated since the 1970s. And so our job is to call on, Congress to put big money into municipal public health departments across the country. Second, we need to ensure that everyone in the world gets vaccinated. And that requires both sharing the vaccine technology, enabling manufacturing of the high quality mRNA vaccines in facilities that aren't just in Europe and North America, but are in Africa, South America, Central America, and South Asia. We need to be financing and scaling up. One of the big victories that we've had just recently is that the World Bank and the US government and the G7 all supported the creation of a new financial intermediary fund for pandemic prevention at the World Bank. And so that's been established. There is a new global fund to fight pandemics that Right to Health Action was at the center of driving forward. Now we got to get it funded. It's unclear. It won't have much impact until it raises the money from governments and private sector to do its job. And so we're calling on the White House and Congress currently to fund it adequately. And then finally, we must, work to stop zoonotic outbreaks. And this is going to be a major function of this pandemic prevention fund, is supporting indigenous communities on the margins of the global political economy, communities who are forced into labor that forces them to destroy their own environment, such as clear cutting forest or strip mining mountains to get bauxite or minerals or oil, and to support those communities to have alternatives to those kinds of very damaging labor relationships that destroy their environment and create the conditions that drive new zoonotic viruses into human populations, things like COVID-19, Ebola, and others. And so, we've been able to show that we can do this. We've had just huge numbers of meetings with members of Congress, flooded members of Congress with letters. We've had 261 members of Congress, which is a majority of the Democrats in the House and Senate, sign on to our stuff. So we're making progress, but it's, we got to keep the drumbeat high. So I'm just going to sort of end. I mean, we've also done some really cool in-person events. We did a big stunt at Moderna in which we all dressed as like Squid Game characters and like dropped piles of money on their doorstep on the day of their shareholders meeting. 3 of our colleagues who have lost parents and loved ones actually calling on Congress to act on the Pandemic Prevention Fund, actually dropped the ashes of their loved ones on the steps of the U.S. Senate, calling on them to take action. And we did a press conference in front of Stefan Boncel's house, Stefan Boncel being the CEO of Moderna, calling on him to support expanding manufacturing of the mRNA vaccines in the global south. So I just want to end with this, and then I will shut up. And interested and curious what questions folks have. But the political opportunity we have right now, and this is something I would call on GlobeMed to potentially work with us on, is the midterms are coming up. So between now and November, our elected officials, or the people who would like to be elected officials, are more vulnerable to democratic pressure and political pressure than they will be ever again in their political careers. When people are campaigning, they have to talk to regular people. Usually they're able to sort of be sequestered in Washington, D.C., in their offices. They're able to really insulate themselves from the pressure of regular, everyday people. And that gives us a powerful opportunity to deploy a tactic that we call bird dogging. And bird dogging is essentially activists attend a campaign event, a stump speech, an event in a VFW hall or an Elks Lodge or a Rotary Club or whatever. and basically ask a very specific, pointed question of that candidate. Will you support a $10 billion funding for a global fund to fight pandemics, Mr. X or Ms. X? You get their response on camera. And we do this over and over and over again with candidates on the campaign trail. And you collect these commitments, basically to policy measures. And it's a way of boxing in a potential member of Congress or an incumbent member of Congress into a set of positions that they might not otherwise want to take. And it's a way of building support for a set of issues. And so we're hoping to do 25 cities, 25 trainings across the House and Senate. We've got organizers all across the country who are working with us on this. Basically we're calling on them to, basically get commitments to fund this financial intermediary fund at the World Bank. We're calling on them to support making and sharing vaccine technology with manufacturers around the world. And then we're working with a whole host of groups who have survived COVID or dealing with long COVID to basically support funding and financing for long-term disability support for people who are dealing with long COVID. And so you sort of let me end here by making my ask. Priya's here, so she can, we can haggle over it. But can 5 GlobeMed chapters commit to each bringing, 10 of their chapter members to a training on bird dogging? Get fired up about this mode of productive political action in this moment where we actually have a political window to affect some real change. So that's my ask to you after this meandering presentation. Hope it was useful. Thanks for the time.
Thanks, John.
Yeah.
I love that idea. And I say we ask the students.
Good.
And my question for you is, you spent a lot of time walking us through some kind of like deeply entangled issues rooted in violence and exploitation of people that really pose as barriers to health equity, which is what everybody here is deeply aligned around. And I think one of the things that I've been hearing from the community and thinking about myself is just how overwhelming the scale of change that's needed is. And I'm curious how you and the Right to Health Action team decide what to spend your collective time on, like how you prioritize what issues or what bills or what kind of work to advocate around in any given moment. And both like, how do you come to those decisions, and how do you think about your work in relation to other people who are doing this kind of organizing work?
Yeah, it's not easy. I mean, there are, of course, a million different problems and a million different potential solutions and, pathways and vehicles and levers and whatever else. And so, how do you choose? It's not easy. I mean, I think we look for, we've been clear sort of from the start about sort of our biggest sort of theory of change, that like pandemics are structurally driven and that there could be sensible policies that would dampen the structural drivers of pandemics, and that we should focus our interventions, our policy vehicles or whatever the particular policy levers we have, we should choose those based on our assessment, which is fallible and incomplete, but what we've got on which will be best at doing that. And we assess that against a different set of sort of criteria, which is, well, what's that political moment? We got to know and understand, well, what is the rhythm and cadence of the legislative season? Where are there opportunities? When are there going to be big new emergency funding bills that come up at the House and Senate to finance, COVID relief or to deal with infrastructure? Or when are there going, the thing is, I think very few Americans, and I mean, frankly, myself, and I think so many of us, like, really understand that the legislative system is almost completely broken. There isn't a regular, legislative process. They pass these mega omnibus packages, which are these enormously horse-traded kinds of mega bills that involve the specific negotiations of particular members of Congress, and in order to get the 60 votes necessary to get it over the hurdle and pass. And so the game is knowing what is Nancy Pelosi and Chuck Schumer's sort of legislative calendar, what are going to be the bills that are going to be coming up, and working with coalitions of other organizations, working with skilled lobbyists who understand and have relationships with chiefs of staff in key offices, to essentially work on developing and drafting legislative text that could be inserted into those mega bills, and then mounting the grassroots army that can bang down the door and say, we demand our little piece of this thing be included in that mega bill. And that's the only way you make you can kind of notch up, ratchet up, small pebbles of victory on the victory side of the scale. But it requires, like, as best you can, an understanding of that process, figuring out what those key sort of but it changes really quickly. I mean, Congress is a very dysfunctional institution, and their calendars are really unclear. It's not on some regular schedule. And so it requires really quick adaptation and changes. But I think in the most general sense, it's like staying true to sort of our initial set of ideas about what's driving pandemics, a set of broad policy principles and ideas about what would alter those structural drivers, and then finding these often very narrow and short-lived windows of legislative opportunity to get those things built into law, and then fighting and deploying tactics that can, in our opinion, move those things forward. But it's messy, and it's hard to lay out on some sort of stable timeline, and it's always sort of swirling.
Definitely. No, I think that makes a lot of sense. And I think it's really powerful to have the purpose of curbing pandemics to allow you to adapt, but with a clear through line, with a clear mission of where you're trying to go.
Try to. It's not, but it's far messier than, any of that. It's hard, right? Because and we can't do everything. Is the other reality. And, I think, part of organizing and part of the challenge of organizing is having a way in which a diverse collectivity of people have enough shared interest and shared values and a process to make decisions such that a group can make decisions. Because if a group can't make decisions together, it's not actually an organization. It's not a social movement, because you can't do everything. You have to make decisions together. And so, that's hard. And that means some things won't get done. And some people will not have their preference taken on. And that's not exclusionary. It's just a realistic nature of collective political work. And so, what do you do with that? I think that's a very difficult thing in the contemporary world also, when people want their thing done. And this is where then that's great. And we should build, and this gets actually to the second part of your question, right? Which is, well, how do you work with other organizations? And it's like, well, let 1,000 flowers bloom. We need more organizations, and we need people fighting for their own interests, the things that concern them, and building a constituency of people who also share those interests and values, and organizing them to assert those demands on powerful actors that can give them what they want. But I think, and this is something with, with a name like Right to Health Action. I mean, again, that's like such a broad mandate, and so it's so big. And of course, we're not fighting for every facet of that. We couldn't. But, we can focus our efforts on these things where we have a particular sort of overlapping set of competencies and capacities and resources. And I think that, focusing on that, in time, and deploying those resources in strategic ways is a better thing than trying to do all things at once in ways that move very few balls forward. But that still creates tension, right? And organizations also have to figure out how to deal with tension when there's disagreement. Disagreement's not bad. It's part of the deal, as part of like how organizations work, and democratic organizations in particular. And so, yeah, we have a fair amount of that too. And that's, in my view, a good thing.
No, I agree. I think conflict can be very generative and actually get us bring us closer together if moved through in a way that really honors where everybody's coming from. I have two more questions, but I feel like you and I could sit here and talk all day. So Jonathan, stop me if at any point you're like, no, we really do have to wrap this. My second question for you is, I feel like our society has been like collectively pushing and collectively grieving for like multiple years through this COVID pandemic. Have you had a chance to think with the Right to Health Action team at all about like self and community care, what it looks like to do this work while staying whole humans, what it looks like to participate in social movements without burning out?
Yeah, I don't know that we've, been successful with it, but definitely talk about it. I mean, I think one of the things that, is most, exciting and generative and, hope restoring and energy restoring in these kinds of social movements is winning. Seriously, like, I mean, if it's just a never ending losing battle and you're asking people to fight for a losing cause that will never have any hope of doing anything, I don't think that's going to last that long. But we can win, and if you have the right strategy and you do the work well, you could win. And I think, this is always another sort of dialectical kind of challenge that organizers have to confront is, having these, big objectives and strategic goals and sort of calling your shot and saying, this is what we're going to do, versus having things that you can claim victory on, and say, we did that. It wouldn't have happened had we not worked together to do this. And it's even better if those things make a material difference in the lives of the people working together, right? If they see that difference, then that makes, so, making it concrete, making it, moving it from sort of abstract principles and pronouncements to things that make a difference in people's lives. Like, that is motivating and that is powerful and that's exciting. I mean, that doesn't get to your question, which I think had more to do with sort of like process and like, well, how do you, and I think, meetings actually don't have to be a giant suck on everyone's energy and time. They can be fun and validating and joyful. And, I think, we have meetings that are definitely not that, but we also have meetings that are that sometimes. And, I think thinking through how to make meetings spaces of realness and work, but also sort of like levity and like fun. And COVID sucks in such a way that, like, I mean, GlobeMed, I think, has benefited so much from in-person gatherings, and that that's where, relationships just go to another level and commitments sort of skyrocket and people are like ready to take on another year. And I think, it's hard to replicate that on Zoom. I don't think it's impossible. It's not the same, but I think there are ways of using technology in ways that can be, that we can be more creative with. But, you know, there's something to be said about just the joyfulness of getting a group of people who share a set of like interests and values together and doing real work together that feels like very serious and like crucial, but also creating space for just like play and fun. So I don't know. I think those are things, but I think more than anything, plausible pathway to victory and having even modest victories along the way, nothing better than that.
Awesome. Thank you. Final question for you, if we can. You know, you talked about disparities, racial disparities in health, and wanting to organize with an anti-racist lens and with a kind of push towards anti-racist policy. And I'm just curious how you go about doing that.
Yeah. I mean, I think, first and foremost, it's having a team that brings, perspectives from, racial experience, racialized experience that I don't have. And, we have a team that, is majority Black, Indigenous, people of color, folks who, I think, push us in important ways. And I think that it has to start sort of from that perspective. I think, from, global health, sort of as an endeavor, as, and, GlobeMed knows, is, it comes out of, colonial extraction. Its whole sort of purpose and sort of set of institutional, organizations, the institutions that govern global health are relics, if not actively reproducing sort of different kinds of exclusionary, colonially, rooted exclusions that, are justified or sort of propped up by racial difference and racialized, racist difference in the minds of, these powerful actors. And so, I think, the COVID-19 pandemic is a potent, just, across the board, a potent empirical and real life and current example of like how this stuff plays out, right? Whether you talk about zip code differences in COVID rates and death rates, or global vaccination rates, you can see these things map onto all manner of extractive processes, of which sort of racialization is one. And so I think, we work with organizations and people who understand that and try to focus on pragmatic policies that move that forward. I think, the best and most anti-racist work we can do is to try to fight for real winnable policies that move resources towards those communities and not away. And, I think that's sort of our task as best as I understand it.
Thanks, John. I always love hearing your perspectives on things. I feel like you have such a strong, historically rooted analysis of advocacy work, policy work, health equity work, and it's just always a joy to hear from you.
Yeah, we're trying. We're all trying here, and we'll keep banging away at it. But really grateful to you, Priya, to Jonathan, to India, for the entire team and everything that you're doing and all the chapters. Like, we just got to, keep banging away at it as best we can. But thank you for the opportunity. It's really, really an honor to talk with you, and be in touch. You've got my email address. Feel free to share it widely. I respond pretty quickly usually. So anyone can email me and we can be in touch.
Great. Thank you, John, so much for, again, this wonderful, wonderful discussion. Like I said, we'll have it to share with students. We have it on YouTube, and again, just thank you for all that you shared and the responses to the questions.
Great. Thank you, India. Appreciate it.
All right. Well, I hope everyone has a wonderful rest of the day.